and Brother Asif.
Alaikum. How are you doing, sir?
Assalamu alaikum.
Assalamu wa rahmatullahi wa barakatuh.
Alaikum assalam.
Assalamu alaikum.
Wa alaikum assalam.
Alaikum assalam wa rahmatullahi wa barakatuh.
I want to know, I've not seen Brother Amir has
Rahim. Shukr alhamdulillah. And this presentation is Fi Sabilillah. My name is Dr. Najeeb Ranginwala. Today I'm going to present about internet and effects of internet on our kids, teenagers, and that's the topic. Last time, Brother Asif Khan presented eloquently and very informative presentation on internet and screening time on our kids, which leads us to the behavior issues and as well as medical issues, which I can briefly discuss. So that will be my presentation for today. For that, I send you an article regarding the internet and the psychopathology related to that. That's a core concept. So today my presentation is basically to step up what was lacking in a paper to have a better understanding where psychiatry is about that, because a lot of things cannot be described in a paper because of restriction of amount of material you can put in. But in a live talk, you can talk more in detail, and it's a live interaction. So I just want to bridge it up, and so you have a better understanding with a good reasoning. So hopefully you have read that paper, because I will go above that. So that's where I will go. So in that paper, it describes, by any chance, did anybody read that paper?
I had a chance to review it.
Okay, good. Okay, that's good. So people have reviewed it. Okay, so I'm going to pick up those areas which the paper did not discuss in detail, and you have questions regarding that. And this is where the presentation will be. So one of the things which was discussed in that paper is that psychiatry does not acknowledge addiction behavior except gambling because of lack of data. So let me explain why psychiatry, the only thing which is acknowledged is gambling, which is non-substance induced addiction, and rest of it is not acknowledged because of insufficient data. So the reason why it is that when we do, so this is how we do in research, human research. So in a human research, we do two types of ways: experimental studies or observational studies. The observational study is picked up based on the risk factor. So if you have a risk factor, you do observational study. You don't do experimental study. Let me explain what is a risk factor. So somebody who has, means like what I will say, sexually transmitted disease, or shopping and all those things that can lead to consequences. We don't do experimental study. Usually it's done observational study. So that is determine what route you will do in research setting. So you do observational study in internet related issues or behavior. So, and when you do analysis and all those things, that is called epidemiological studies, basically. So you can do analysis based on that and conclude. The biggest thing which comes out is the cause-effect relationship is not that clear. That is very significant in observational studies. So because it's not experimental study, it is observational study, so risk cause effect is not well established. So it takes a lot of data to establish that cause. And from there onwards, you do hypotheses, like Freudian hypothesis, and all those in psychiatry when we do thinking, like what theories and all those things. So these are all hypotheses. So that is where it is. So this is one way of going through it. The other is experimental studies. So in experimental studies, you know clear cut, and you do cause effect is a strong relationship over there, because what causes you have effect on it, and you have a very clear, because you have placebo control, randomized, and all those things. You do it in experimental studies, so it's a very clear effect. The other thing which comes is placebo effect and nocebo effect. Placebo effect is basically when you feel like you will get the best out of it, which is 30%, that you are very interested in knowing about it, that you will get better. So that's why it's called placebo effect. And nocebo effect is basically you are thinking that nothing will get better. So that's nocebo effect. So you always keep in mind that these are the two effects in experimental studies. And then in experimental study, you have pilot study with clinical trial, phase 1, 2, 3, and 4. Phase 1 is basically after pilot study, you have a small group which go into study to see the effect. The phase 2 trial is much bigger group to establish the phase 1, because now you are completely established. Phase 3 is FDA approved, so you want to approve by the FDA and all those things. So it's more major multi-central studies, and phase 4 is long-term effects of it. So these are all these experimental studies. So you have all in this biases and confound, but you can analyze very efficiently that what are the biases and confounds in the study, so you can rectify and come to the correct conclusion. So when we are doing the internet study, internet related behavior is an observational study. And since we don't have enough data, that's why American Academy of Psychiatry or DSM-5 has not included internet behavior as a addiction. In fact, gambling online is also not included in DSM-5. So that is one of the reasons why we don't have any diagnostic criteria at this time, but it will take time to develop it. So at least you have an idea why in psychiatry we don't have diagnostic criteria on that issues. This is how the experimental studies are done. It's 5-layer. It goes into minor detail about it, but I just want to know that's a very tedious. You do all different layers to get the data over here. So this is called the research onion. So basically layer of the onion, you go through it for either observational study or as well as experimental studies. So it's a very detailed, so that's why we do a lot of time to get the data. The other slide which I want to tell you, this is the main course slide, how the human develop. So this gives you all the different factors as the child is growing up, but the things which you need to know are the receptors and synaptic refinement. So the receptors are where the nerve terminals, where the sodium, serotonin and the dopamine and all those receptors where they transmit from the one neuron to another are. And synaptic refinement is the neurons changes based on the needs. So this is two things which we need to know regarding this internet behavior. Receptors are green. So you can see the receptors keeps on going up all the way here, they are plateau and comes down. Okay. So these are growing up, and the synaptic refinement takes place at the age of 7 going up. So the reason why it's so important is that every time we learn something, a receptor is created in our brain, and receptor and the synaptic take place. So it's a pathway where you learn something, you have a system intact in your brain. You learn a word, you learn a habit, a new receptor is created. So our child is learning new factors, new things. When we are learning through internet and all those things, these are the things we are going to learn from here. And this is the normal growth taking place. So when you're using internet too much, you're learning through the internet. And then the pruning of which is called synaptic refinement take place, where if you're not using it, they cut it off. So this is the normal mechanism of your body running into your brain. So you want to learn things in a proper way. And that is very significant, important, rather than a way which should not be healthy to your human body. So internet is not considered very healthy because social interaction between from a person to person decrease down. Your way of learning changes, and your pathway are created totally differently than a normal human being develop pathways. So that has to keep in account that how much time exposure you're giving and how much early age you're developing is significantly important, because this is how the brain works in a human. So you'd like to develop the right habits, the correct habit, and the healthy habits, rather than using other habits which are not healthy. So that's why I brought up this slide, to make you understand that using internet at early ages can be so much detrimental to child growth also. Using internet for for an hour or two is fine, but if you're using more than 3-4 hours, or iPad or iPhone, that will affect the behavior of a child significantly. As we can see, this is how they develop. These are, I brought it up because this is how the brain, the neurons in the brain develop. So you can see it keeps on building up at 3 months, 6 months, and then 2 years is pretty much saturated. And then the pruning takes place. Pruning means cutting the neurons which are not being used. So you have the skill to learn anything, because the brain is completely blank and wants to learn everything. So you want to learn the correct things and the healthier things, rather than in bad habits. And if you don't learn those things, they start pruning it up. Just like when you do gardening and you prune the shrubs and all those things. So the brain say it's useless. We are not using it. So that's why they prune and cut it off. That's why the learning of language is very important at early age, because your brain have a receptor for any sound you produce. When you get older, it's difficult to learn, but you can learn, because brain has a capacity to learn, but it's much easier to learn at a younger age. So this is what I'm trying to explain, that the brain changes as you grow, and you need to learn at the right way rather than non-healthy way. This is one slide which you have to understand how the brain grows, and this is significantly important. So this is the front portion of the brain, which is here, and this is the back portion of the brain over here. So so when maturity happens, what happens is that each neuron, I can explain, neuron is like a electrical wire. So in an electrical wire, you have a copper in the middle, and the covering is by a plastic to keep it intact, so it transmits the electricity much faster. Same thing happens in your brain. You have a neuron which is surrounded by oligodendrocytes and all those other microphage and all those things, which are covering the neurons very well, myelin sheath. Basically, they're called myelin sheath. So when they have a thick myelin sheath, the transmission goes much faster. How it is developed as they grow, it starts from the backwards, from the backside of the brain, from here, and it goes forward. So you can see it's developing more in the middle, and by the time they completely mature, which is around 12 or 15, it's in the front. So the frontal lobe is over here, where your wisdom and all those things comes in. The prefrontal cortex develops here. So that is the last thing that develops. Before that, it's the back portion develops. So child is more reflex oriented. So it's not mature enough. So it's learning the way how it's learned by knee-jerk reaction, because it's not mature enough to learn it. So when you have internet interactions over here, when the child is growing, they're not learning the right way. So that's one of the important features you have to think about it, how the brain is developing, and they will pick up all the wrong habits because they are not tuned that way. They are developing. So don't expose internet so much earlier age group, because they are not fit to develop that way. This is another way of looking at it as a child is developing. So this is the back portion, this is the front portion of the brain. You're developing from backwards in the front. As the time passes on, you're fully mature. So by the age of 20, your frontal lobe, or where the wisdom center or prefrontal cortex is fully developed, you start thinking properly, you analyze things and all those things. A child does not do that. So that has to be kept in mind. So the behavior, what you teach them earlier, they learn that behavior and they keep that in mind. So you should learn the proper behavior at early age rather than incorrect behavior. This is what I need to explain to you how the brain works. So you have in the middle portion of the brain, you have the caudate nucleus and hippocampus, all those, which we call striatum. And this is the prefrontal cortex. Basically, when the child is growing up, this portion is very much well developed. This is the emotional center of the brain. This is over here, emotional center of the brain. The prefrontal cortex, which I told you, is developed at the late stages of life. Means after the age of 20 and onwards is developed. So whatever you learn is learned over here, and which is a knee-jerk reflex over here. So what happened is that basically when you're learning knee-jerk reflex and you're not using the wisdom. As the time passes on, the wisdom catches up, prefrontal cortex develops. So you want to learn the right way rather than the knee-jerk reflex pathway through the internet, because it addicts you to go into that direction. So that is explained. So in adult, the prefrontal cortex is very well developed, myelinated, and has the wisdom to direct the striatum to correct itself. In a child, this is predominant, and this is not functioning to the maximum level. So you have a knee-jerk reflex. Here it's almost the same. This is where it predominates. So when it dominates, you have a better thinking and wisdom of how to approach things. So that's how the child physiques and the thinking works. The most important thing which you need to understand is, in addiction, you have a reward and punishment phenomenon. I discussed last year also the reward and punishment in the happiness and pleasure sensation. So this is the slide, I took it out from there. So you have a dopamine pathway. There are 5 different pathways: the mesocortical, nigrostriated, tuberoinfundibular, and mesolimbic pathway. Mesocortical goes into the frontal lobe. So when you have excitement, your dopamine goes up from here, which is ventral tegmental nucleus, and it spreads out all over the brain. So this is where the brain really fired up in excitement, the reward phenomena. In the internet-related behavior or addiction behavior, your reward phenomena kicks in really fast. And knowing that the prefrontal cortex is not well developed, it's working over here right now. So this is the reward phenomena works here, and the reward phenomena is from the dopamine as well as also from serotonin. So dopamine is a pleasure pathway, and serotonin is a happiness pathway. Both works together initially. So these are the pathway from here to spreading out throughout the brain. So the child brain is very immature at that time, and they just know what excites them. Even it can be detrimental to them. And they learn this phenomenon, and as I said to you, they develop all the receptors and synapse at that time because they're enjoying about it. So basically, they learn all the wrong habit, and the prefrontal cortex does not develop at that time. These are all the different centers. I have to go a little faster now. Time is running out. So these are all different centers of the brain for the reward phenomena, from the dopamine and serotonin pathway, which excites the brain, and they enjoy the addiction behavior. This is also the same thing, VTA, ventral tegmental and amygdala, nucleus accumbens. These are all these centers which affects all over the brain. The other pathway is the punishment phenomenon. This is the hypothalamus and other areas are the punishment center, which produce GABA and glycine. So these are the, when you have punishment, these are the one kicks in. So just want to let you know that these also influence the behavior pathway, reward and punishment. Now remember, the prefrontal cortex is not fully developed. So when you're learning the addiction behavior, you're learning only this thing, and you're learning the wrong way of thinking at earlier age, and that become a habit. When it's become a habit, it's very difficult to get out of it. So that's why addiction behavior is very detrimental at a younger age group. These are another way of expressing, going to the neurophysiology and all those things to discuss about it. These are the tracks in the brain connected to all the areas of the brain. But as you know that adolescent child uses the limbic path system rather than the prefrontal cortex for process of information. So they enjoy the addiction behavior extremely and going from that. I cannot end on the behavior of circadian rhythm. This is the most other important things to think about it. Circadian rhythm is basically when you see in a human body, you have circadian rhythm. So when you see the light, it has a blue spectrum coming from the light. And when it hits the eye, it goes to the hypothalamic nuclei. One of the transmission go to hypothalamic nuclei where circadian rhythm is run. So basically from here, it's sent through a pathway to the spinal cord and goes back to pineal gland, which produce melatonin. So during the daytime, when you're getting the light, which is the blue portion of the light, it gives the signal to the pineal gland to secrete less melatonin, or you don't require melatonin. And when this is not produced, it goes back to the loop to the hypothalamic region, telling that it's a daytime. So your human brain realized how much blue light is based on that. It's a daytime. The sky is blue. The human brain analyzed blue portion of the light as a daytime. So any fluorescent light, any internet using screen which has blue light, more of it, will give the brain that this is a daytime, so they will not go to sleep. So this is just the tip of an iceberg. The real story comes here. The suprachiasmatic nucleus, the hypothalamus, where they produce the circadian rhythm. Yes.
Dr. Najeeb, the request is that you take your time. We're enjoying the presentation. Because you said you wanted to rush a little bit.
Yeah,
So
because it's 9 o'clock presentation.
Nobody wants you to rush. The other thing is, if you could just put the presentation mode on your presentation itself, this way the slides will be a little bit larger.
Oh.
So at the bottom, yes.
I'm not seeing, where do I get?
Okay, probably go to view, on the top banner, go to view.
Just a minute, where's the view?
Okay, so it starts from home.
I think if he goes down in the scroll bar at the right side.
Yes, it will do it, but it didn't do it for him for some reason. I didn't see if it did it or not.
It's not showing up that thing.
I think
To enlarge it.
Yeah, I think because it is the in the right side, the scroll bar, go it down, move it down.
Oh,
Not
okay.
here. Yes, move it down. You can see the end of your slide. Yeah. Oh no, let's move it.
No.
It doesn't
Okay,
work.
just go to view. Just
Yeah,
go
I
to
think
view. Go to view, which is like next to help. See, there's
Okay.
help view.
Somehow the screen is not showing that thing. Slide, and it's very important slides to remember. I think so. If you learn this slide, it will be very important. So as I mentioned before about the slide, that the light comes from your eye, goes to the hypothalamic region where the circadian rhythm is created, which is hypothalamic nuclei. this nuclei which produce circadian rhythm also stimulates a lot of other rhythms in your body. And these are all the rhythm produced in your body. Your endocrine rhythm, the thyroid rhythm and all those things. Your temperature regulation, the appetite center, the autonomic nervous system, which is sympathetic and parasympathetic nervous system, your thinking power, your mood, anxiety, and then you have other things like blood pressure, glucose, and other clearance of the body. That is also the rhythm this hypothalamus control. So with this light, other centers are also there and it's all connected together. So basically it's a very important, it's almost that this center is just like you are in a driving seat of a car. This is where the light is coming and stimulating it. So other centers are also influenced by this light and whole hemostasis take place. So it's just not the light and the sleep, but all the other system of the body is also affected. And if you look into the psychiatry, like when there's a sleep abnormality or sleep deprivation, the attention deficit disorder, which we look into whether sleep is deprived or not in the people who have attention deficit disorder. This is the first thing that get affected. In depression, sleep is the first thing, which is called neurovegetative symptom. This first thing get affected. And a manic bipolar, sleep is the first thing get affected. You have anxiety disorder, sleep is significantly affected. Psychotic disorder, sleep is significantly affected. Eating disorder, you can literally look into all the mental health disorder. I don't think so sleep will be excluded. Now, I'm not talking about sleep disorder, which is totally different. I'm talking about other mental disorders. Sleep is always affected by sleep affects all the psychiatric disorders. So sleep is very important for mental health. And so the internet does affect significantly your sleep cycle, indirectly and directly, and indirectly all the other system of your body get affected. So you get very irritable, your concentration goes bad. In Alzheimer dementia, we have seen that the sleep is so totally affected. We want to maintain the sleep. That's why we have sleep hygiene. When you go to a doctor and they talk about it, so sleep hygiene is how much time you spend on internet or the screen or TV, and when was the last time you saw before you go into sleep, because it takes 2 hours before the melatonin start producing, so you get the effect that is the nighttime. So it's significantly important this that how much light it goes into your brain, and it's indirectly and directly affect the whole system of your body. So as we put together, this habit is not really good for us, for our kids growing up, and it develops a wrong behavior. It changed the hemostasis of the system. It changed how you think about it. The behavior thinking changes totally differently. So that's why it has a lot of detrimental effect when you're using internet for a long period of time. So the usually time they say is 1 to 2 hours of screening time, or 1 to 2 hours of watching TV, and that's it, because you want to develop healthy behaviors. And that is significantly important for all of us. I think so. That is what I want to express. This was not described in the paper. So I just want, because by all these slides and all those things, you can understand much better why it's so important for us to develop a healthy, good behavior. Anybody has any question, I'm happy to answer.
First, thank you, Dr. Najeeb, for your presentation. My daughter Maya has a question, so we will.
Am I her friend anymore or no?
Is she your friend or not? She doesn't know. She has to make a decision. Okay, what is your question, Maya?
Okay. What happens to the brain
Mhm.
if brain if we watch for like 5 hours, something like that, every day or a day.
So can you watch internet for 5 hours?
Yeah.
So she's asking what happens to the brain in that instant.
Well, you develop wrong habits. So basically, we want you to develop a good habit, socialization, the right way of playing with your brothers and sister and all those things, healthy activity outside or inside, talking to your parents, grandparents, all those things. When you're spending too much time on internet, your behavior changes. Your internet become your parent. I sometimes tell to my daughter, who is the parent, internet or the parents? And she has to decide who is the parent. So you want them to understand that internet is for learning purpose or for a little bit of enjoyment, but it's not the way of internet is not your nanny. Internet is not going to take care of your things, and which is a very hard choice because of the lifestyle we have, that we use internet so much to do our work and use as a nanny. It should not be taking place. They should have healthy habits. And so it's not good if you're using for 5 hours. That will be the short answer.
Thank you.
Thank you.
But you're not alone, because my daughter also sneak up and use internet, and I finds out and she's in trouble.
Yes, somebody was grounded a few weeks back for that. So I think I want to welcome Mr. Ed Hernandez to our meeting, and we will start with Mr. Ed Hernandez. We can continue this conversation because this is a very important conversation. Those who did not get the article, please send me a text or send Dr. Najeeb so that we send it directly to you.
I send it on the Isha group.
Yes, and I sent it also on the Aisha on the Signal group, and with a message also. But some people, like I know Cal is not on the internet, but I forgot to send it to him, not on WhatsApp. So anybody who needs it, either contact me or Dr. Najeeb, and we will send the article to you this way for your conversation.
Everybody on internet.
Also, Mr. Hernandez, we will start. We have recorded this meeting, so I'm going to stop the recording. And then